Welcome to the 64th TDCC live webinar, From Meltdowns to Connection, Understanding Emotional Regulation and Communication in Autism. We are honored to welcome Sharareh Zainalian, Head of ABA Therapy Services at the Developing Child Center, as our speaker for today's session. Sharareh holds a Master of Arts in Special Education and brings over 17 years of experience in the field of applied behavior analysis. She is a board-certified behavior analyst, BCBA, and internationally recognized as a qualified and certified behavior analyst, QBA, IBA. Her expertise spans across the lifespan from early intervention to adult programs, where she specializes in developing individualized behavior intervention plans, inclusive education strategies, and vocational training programs. Sharareh is also certified in skill-based treatment, SBT, Level 4, and actively trains and supervises candidates pursuing RBT, ABAT, IBT, QASPS, and QBA certifications. She is deeply committed to empowering families through parent and caregiver training, and she is well-versed in administering key assessments such as the FBA, VB-MAP, AFLS, ABLLS, and Essentials for Living. Her leadership in ABA program development and dedication to inclusion make her a respected voice in the field, and we're excited to learn from her today. Ladies and gentlemen, let's welcome Sharareh.
And I'm very happy that we have a lot of participants from all over the world, and it's very exciting. And let's get started. We are going to talk about from meltdown to connection. Because every meltdown that we're witnessing is an opportunity to strengthening the connection through understanding and building the skills for the individuals. By the end, you will be living with practical strategies, how to recognizing emotional distress early, use proactive strategies without the need of interacting to the escalated behavior. Also, you will learn how to strengthen the communication using different tools and support positive behavior. Let's begin with understanding meltdown. Meltdowns are intense emotional reaction that is very common in individuals with autism and related disabilities. They often appear in a sort of frustration, anger, or distress. Obviously, this situation can be very overwhelming for individual and for the people around them. That's why understanding meltdown is very important to be able to give the right support and effective support to the individuals throughout these episodes. To do that, let's differentiate between meltdown and tantrums. Meltdowns are involuntarily. They're neurological or psychological responses on the overstimulating situation. In a simpler word, that the child loses control of an emotion and behavior. Versus tantrum maintains some control over the situation, it is goal-oriented, and it's voluntarily. During the meltdown, the individual may not respond into the comforting or into the rewarding or reasoning of what is happening. Versus during the tantrum, the individual is usually looking into the adult's reaction. Meltdowns usually ending only when the child is being regulated or the stress around them has been reduced. Tantrums, however, ends only when the child gets what they wanted or they realize what they are doing is not working. Meltdowns are, as we talked about it, is frequently observed in children with autism and related needs, versus tantrums sometimes is being observed. To understand it a little bit better, let's just go through some practices and please feel free to participate. The first scenario says, during the school assembly, a child suddenly covers their ears, starts screaming, and throwing themselves on the floor. They don't respond to direction, even when they offered a preferred toy. What do you think is this?
It's a sensory overload.
We're talking about a difference between tantrum or meltdown.
A meltdown.
A meltdown.
Yes, it is a meltdown. Anybody wants to say why?
It's involuntary and they're not responding to the adult who's offering them distraction or a toy.
Yeah, correct. Thank you so much. The next one says, while a parent is talking on the phone, the child starts whining loudly, pulling on their sleeves, and throwing toys. Once the parent ends the call and gives them attention, the behavior stops. People, thank you so much for writing on the comments. I'm trying to, yeah, oh, tantrum. Okay, some people are saying
Yeah,
tantrum.
that's a tantrum.
Yeah, that because that's correct. That is a tantrum because first of all, the child has having some control over the environment, is very voluntarily, and immediately stops as soon as the parents stop talking on the phone and giving them the attention. That's correct. It's voluntarily. Yeah. All right, the next scenario. A 6-year-old learns their favorite teacher is absent. They frown and yell, I don't want a substitute teacher. They knock on their water bottle, but they come quickly as soon as they've been offered a sticker or a special role of the helper. What do you think is this?
Tantrum.
It's a tantrum.
It is a tantrum.
Yeah.
Yes, there has been a disruption into their schedule. Suddenly, their favorite teacher is absent. Obviously, they have become upset, but they're still having some control over the environment. And as soon as something else, as a substitute offer of the choices and the stickers or being a special helper has been offered to them, because they are looking into the adult's reaction, is the behavior has been stopped. Similar situation, a 6-year-old child arrives in the school, learns their favorite teacher is absent, they scream and collapse on the floor. Attempts to comfort are ignored or worsen this reaction. Behavior continues for over 20 minutes, even when they offer choices.
Meltdown.
It's a meltdown.
Yes, right, it is a meltdown. Again, there has been a different situation into their environment, and the favorite teacher is being absent. However, it took time for them to regulating themselves for about 20 minutes. And when the adult wanted to comfort them, is also worsened the situation. Okay, now as we know that difference between meltdown and tantrum, let's understand to what could be the triggers of the meltdown. It could be environmental, emotional, physical, or social. Environmentally, as we just had an example about it, it could be the noisy environment, a lot of lights, or chaotic places, or unexpected changes into their routine, or a disruption to the familiar routine for them. Emotional triggers could be frustration, not understanding the concept, a difficult task has been presented that they have to complete it, or feeling unsupported from the people or environment around them, or they might feel fear or anxious about to the again unfamiliar environment, or they might even losing control over something they used to have a control over it. Physical triggers could be feeling like hunger, thirst, being sick, illness, or discomfort. Social triggers could be misunderstanding, bullying, or conflict with the peers. So, what is the usual reaction towards these triggers? Communication. So, the individual starts communicating, either verbally, through speech. Somebody was writing something here. Okay. Through speech, and like it could be full sentences, very comprehensive, lots of reasoning, cause and effect, or it could be just using one and few words, or maybe the learner knows how to write or type. It could be in a form of a nonverbal communication. The learner might communicate through gesture, or they might know sign language, or they might know any sort of the AAC, such as picture communication skills, or using their tablets to communicate. If the learner does not know how to communicate, verbally or non-verbally, they are communicating in another way. They're communicating through having some challenging behaviors. Because again, there has been some changes and triggers internally or externally in their environment, and they are not able to express themselves. That's why they are having some challenging behaviors, because that's the only way they know so far. And that regardless, if even the child, we might have a lot of students or learners that they are very well completely talking and having lots of full speech. But when these triggers are happening to them, they start engaging into challenging behaviors because the functional communication skills is missing. So as we are going to learn how to prevent the challenging behaviors and learn how to communicate, let's get started. The first step is that we are going to know the early warning signs. Then we are going to identify why are they happening. Then we are going to select the appropriate communication as well as the communication mode, which is appropriate for the child's level. We are going to go all steps in details at a later stage. To get it better, first, let's go ahead and understand some of the early warning signs. Most of the meltdowns are not happening so sudden. Mostly the meltdowns are happening because the early warning signs have been missed. So it is important to watch into the body language, verbal expressions, as well as the facial expressions for the learner to understand these signs. Some of the examples could be breathing changes, holding the breath, or rapid breathing. The facial expressions could be tearful eyes, frowning, or sudden laughs or smiles, gazing or having an extreme eye contact or removing their eye contact. The body language could be fidgeting or shifting their body or getting too close to the people around them or just freezing their body. Repetitive behavior could be rocking or scripting, or it could be some changes in increased or decreased volume as they're talking. They might be whispering or start talking in a louder tone as their usual talks. So now as we have talked about a little bit of examples of what could be the early warning signs, let's understand how we're going to identify them. One of the very common ways is collecting ABC data, antecedent, behavior, and consequences. And it's very important that these data to be collected, obviously observed directly from the students, and to be directed consistently at least throughout a couple of days, and with different people and in different settings to be able to get comprehensive understanding of the individual. We're going to understand the antecedent. What happened right before that we see the early warning signs? And what exactly happened as a behavior? What could be those early warning signs? We are not talking about, or we are not looking into the escalated behavior. We're looking at the body language, tone of the voice, and their facial expression. And we are going to list it, how does it look like? And then what was adults' reaction afterward? Another thing that we are going to observe and document it is about the timing, setting, activity, and difficulty. What time of the day is usually happening? Is it happening mainly in the morning as soon as they arrive to the school, or towards end of the day, or during the lunchtime when they are in the noisy environment? Is it happening mainly at home or in the school? And during what activity? Is it during math time or PE time? Is it difficult for him to do? Is it because of the people and peer around them? Once we got all of this information, we are going to gather it and list exactly what are those body languages look like, what are those facial expressions look like, and what are the vocal changes they're having in there. Once we got all of this information, we are going to have the root cause analysis, the what, why, and when. And we have to note and remember, sometimes behaviors might happen at the same time for multiple reasons. Sometimes it's happening only for one reason, but sometimes multiple reasons can come into the picture and become the why. So now as we identify the early warning signs before we start implementing any teaching, what are we going to do? Acknowledge the feeling. Use the validating statement to the learner. You can say, I can see that you're upset. And then immediately show some empathy. Get down to their level, obviously to the making sure that both you and the learner is safe. Have an open facial expression, relaxed body, avoid over talking, and avoid also giving any demand and instruction at the same time. And then reinforce the precursors immediately. Something like, I can see that you're upset. I'm sorry that you're feeling that way. I'm here to help. Why don't we just take a break now? Why are we reinforcing the early warning signs? And why is it very important to do that? First of all, it's much easier to redirect it. Intervening before the full escalation of the behavior requires less energy from everybody being involved. And it builds trust and safety. And it teaches the individual the emotional security and regulation skills. Also, the individual will understand that somebody is realizing their feelings and they're being recognized and respected. Also, it's been preventing the reinforcement cycle that the individual has to exceed all the way to the escalated behaviors for their needs to met. Now, let's get into teaching. As much as we are doing that in order to get the building the rapport and making the individual feeling safe and secure with us, we have to step into teaching as well. So the first thing is we are going to teach the functional communication skills. If you remember earlier, we were talking about our observation to identify as much as about the precursors, why and what is happening. And then we are going to understand, so based on that, we are going to understand what are we going to teach them to communicate. And based on the learners' development, are they verbal? Are they using the sign language? Are they using picture communication or AAC? We're going to choose the right mode for them. Let's have an example of the moment that we're presenting the difficult task for the learner, showing some sign of the precursors or early warning signs, and we are going to teach them a break. We can have a picture of the break and start modeling it to them. So the moment that we can either point to the picture of the break or exchange the card of the break and immediately give them the reinforcer of the break. Just go for a break. We're going to continue modeling this. It's very important at this stage because the student has to get the concept. What just happened? So before that, as much as I was having my precursors, everybody were pushing me to do the work, and now somebody is pointing to the break and letting me go. So we are going to continue that until the learner really is understanding the concept that is about this picture to be exchanged or to point it at. Or it could be just like even verbalizing the break, or even approximation of it, or having the sign of language of the break, or pointing to their AAC devices. Then we are going to the next stage of prompting. Depends again on the student. Some learners immediately get the concept and just handing over the picture immediately to you. But then we can start prompting to the learner in a way of helping them to point to the picture or giving them the card to give it to you, and then slowly and gradually decrease this prompt until you will reach the independency. And obviously, again, in the prompting level, as soon as this has happened and the child has been handed over with your help, the card of the break, it reinforces it immediately. This process continues until the child is independent. Again, at the stage of independency, as soon as handing over or pointing to the picture of the break, we are going to grant the reinforcer. Then we are going to generalize it across different people and different settings in making sure that the concept is completely gotten, and then we can be happy to go to the next level. Let's just do a little bit of more examples now here to understand the mode of the communication and what are the learner is about to communicate. And again, feel free to interact in the chat box. So Adam starts stomping his feet when asked to do the worksheet. What is he communicating? Yeah, he's probably communicating that I don't want to do this or it's too hard. So what can we teach him? What is a communication? Refusing or escaping or it's too hard. That's correct. Yeah. Yeah. So what communication based on this escaping we can teach him? We can teach him to just say break or having the visual card of the break or pressing on his iPad for the break or having the sign language. Again, depending on the learner, these can be like sentences, or it can be just one word, it can be picture. It is advisable because we are at the very early stages of teaching the functional communication. Do not make it complicated. Try to make these phrases as simple as possible. Zahra starts having teary eyes when she sees her peer is playing with her favorite toy during the playtime. What is she communicating? Oh, sorry. Yeah, you already pressed it. Yes, I want a toy and I want a toy back, or I want that toy. Attention could have the somebody responded attention. It could have the we don't know if we were in the situation. It could have the element of attention, but as far as this sentence, it's probably that she wants her toy back. So what are we going to communicate? Yeah, sharing is a nice option. Yeah. Sharing is absolutely a nice option to have to teach the child, or we can say my turn, or we can the child can say by the picture of my turn, or signing that I wanted, or having on his iPad or AAC. Lean walks away when told it's cleanup time. What is she communicating? Can you think about it could be escaping? Yeah. Yeah, it could be the escaping that I just don't want to clean up at the moment. Right. And then what communication can we teach her? Not interested in cleaning. That's correct. Yeah. I love your answers. It's very interesting. That's very correct. Yeah. Um, what communication can we teach her? Either we can teach her to use some visual choices or just say no, thank you, because we want them somehow to be in control as well. Maybe because cleaning up is not something, as we are going to have a different scenarios, probably is not the most difficult task. Or can I just do something else instead? This is in case that they wanted to be in control into their situation. Okay, so now we have been done teaching the functional communication to our learner. Our learner is already trusting us because we have been, as soon as we have been seeing the early sign of precursors, we were immediately reinforcing and letting them to have whatever they want to have. And then we started teaching the functional communication. Then they are independent and it has been generalized. So the learner is feeling safe and regulated with us. We're going to start the toleration only if the both options have been ticked. The child is bonding, feeling safe and secure, and as much as we are seeing it in their body language and a facial expression and the vocal changes, when they are in distress, we will feel that, we will understand that as well when they are feeling happy and relaxed with us. So how are we going to teach the toleration? Obviously, again, it is different based on the learners and their developmental, but we are going to do with the very basic one. So we are going to start it with the very short waits in just about a few seconds. So the moment the child is handing over the picture of the break to you, just going to say not now. And then you're going to just count 1, 2, 3, and then say, okay, just go ahead and have a break. And then we are going to observe what just happened, how much was he able to tolerate it, and then slowly and gradually and systematically build onto these toleration skills. It is very important in this process that we are using again our acknowledging feeling them, showing some empathy and encouraging them. Like, I know it's hard. I'm here to help you. I know you can do it. This will also helping them to be encouraged because again, I want to remind you that you're already having a good relationship with them. So they trust you. The next step after you're teaching the toleration, it would be accepting no. Frame it positively at the beginning that you can have it after snack time, or have offering something alternative. Even for us as an adult, if you're just being told no, it can be better if you will having some choices to be offered, even if the value is not exactly the same, but it's good to also having something else to be offered to them at the beginning. I want to show you a case that we have started with this case from the very early stages up until to the independency. In fact, actually, it's gone to transitioning and also going to sitting on the task. I'll give you a little bit of background about this child. When we were doing the observation about antecedent behavior and consequences, it was as soon as any instruction given to him or anyone even touching his iPad, immediately the early warning signs was frowning, vocalizing, and dropping jaw. And then if you were pushing forward, it goes to extreme self-injurious behavior and hurting others. We have had so many staff going to the hospital. And then what was he communicating? He was communicating, I don't want to give up on my iPad and I don't want to do it. How was he communicating? He was using his AAC devices, but it was not very functional. And as we wanted to teach the very basic functional communication skills, we have started to introduce the Big Mac button. Also, his mom wanted him to learn some of the functional living skills, such as like setting up a dinner table or folding his clothes, enabled in order to be also doing it at home. And interestingly, as in subject of the setting, these behaviors was only happening in any kind of a therapy settings. At home, with mom, there was no behavior. With dad, there was lots of behavior. So let's have a look at the first video. This is the first step that we started the modeling and prompting. And because for this individual, there was only few seconds observed from the early warning signs into going into the challenging behaviors, we started our process in while he is happy, regulated, engaged with an adult to just get the concept.
Thumbs up. My way. Okay.
So you see, even when I started the modeling, already he was very curious. So he was already bringing his finger towards it. So it was kind of a modeling and prompting together. And he has his iPad, he has his snack. It's a little heaven around him while I'm going to teach him. Because it was a lot of safety concern, and we didn't want the child to have a bad experience with us. So the next step is gone into being independent.
Okay. Thumbs up. Okay.
So you see that as soon as I was saying time's up, he just immediately pressed the Big Mac button of my way. And interestingly enough, in the later stages, while we were still practicing the independence, we purposely put the Big Mac button even way further than him. So he was like walking right towards it and just like pressing on the Big Mac button to my way. The next stage, we wanted to teach him toleration and accepting no. Um, I will be showing you the toleration, but on the next video, I fast forwarded with the stage of transitioning and going on task, which I'm going to explain it to you after the video.
Sure, you're right.
So you see, as I wanted to introduce the waiting of few seconds in between, I wanted to have some kind of interaction so he wouldn't feel the time. So we have introduced the giving high five. He's being interacted while I'm buying the time to just making him tolerate, not being paying attention to his iPad. The next one is accepting no and transitioning and being on task altogether. I just fast forwarded to reach the last stage with you. After we watch this, I'm going to do some explanation about this.
Time's up. What? Now right now. Close the YouTube. Stand up. you. Take the napkin. Wow, look at you being amazing.
So you see that in this process, we have started teaching accepting no. As I mentioned earlier, he wouldn't even let anyone touching his iPad. Now I was turning off his iPad, I was holding the iPad, and he was transitioning with me. And the transition had to go with the step of just standing up and sitting down, and then stand up, just go two step, and again sit down. And then we go all the way there. Environmental modification that we had to do. At the beginning, we had a normal student chairs and tables over there. The moment he was seeing it and he was going to transition to over there, again, he was losing it. So we had to make the environmental modification have a, chill table and a big bean bag over there for him. And right now, as we're speaking, he's just using his iPad few minutes like any other kids in the day for the reinforcement, and he's doing multiple different tasks in different areas. And obviously, about the task as well, we haven't started with three tasks at the same time. When we did the transition, we just let him sit on a chair, and then that's it, done, reinforcement. And then sit on the chair, do one task, sit on the chair, do three tasks. So it was lots of steps and modification. Again, I purposely chose this case because I wanted you to see the very fundamentally that how we are going to do it. Obviously, the learners with higher developmental level, this process can be easier for them. Okay, so as we have talked about the toleration and accepting no and the full communication, let's talk about what we can do about the predictability strategies. Now on next board, I'm sure many of you are very familiar with it, and I hope everyone is using it effectively because this is being something scientifically supported. It is promoting the predictability. Even for us, again, as an adult, we want to know what's happening next. What is our daily schedule? What are we going to do after, I don't know, 2 hours? So some of them could be just like two steps of like, let's have lunch, and then we're going to have going out or to playground, or it could be 3 steps, 4 steps, or it can be just like a full day schedule that mainly we are seeing it in the schools that important in every task. That's correct. Somebody was saying reinforcement is very important in every task. All right. It is very important that when we are having the now and next board, for the individual who needs the support to understand, okay, I'm doing this and then what I'm going to do. This visually to be available and accessible for them. Another one, again, you are aware of it and you know about it, it is timers. Either having it visually or talk about it verbally with the learner, regardless if it's been a difficult task or the favorite task has been ended, about to be ended. If they're in the playground, they don't want to go to the classroom, you can just either have the timer or you can talk about it verbally. We have 2 more minutes, 1 more minute, and counting down. Or if they're finishing the difficult task, hey, look at you, you're doing so amazing. We have only 2 more minutes to go. And then sometimes the timing when it's going to about to end, they're not ready to do that. Negotiate. Let them have some sort of a control over you. Negotiate in a structural way. So you can say, okay, fine, it seems like you want to have more breaks. So do you want to have another 30 seconds or another 1 minute? Or if the child is nonverbal, you can just say, okay, I'm just going to give you another 30 seconds. That's okay to negotiate as long as it is part of you are structuring it in a controlled way. Another method that we are going to talk about control strategies, it is token board. I know that many of you know about a token board, and I do not want you to underestimate the value of it. There are a lot of material is on the internet to get a token board, but I want to encourage you to use the individualized token board for your learner. Understand what is their favorite character. What do they like? So try to have it in a way of being interactive for them. Use those preferred characters, cartoons, toys that they like to design their token board. Then again, going to reaching to the level of number of the tokens. that needs a proper observation and understanding that how many token is required for this learner, not just printing something from internet, okay, 10 tokens or 3 tokens. Maybe it will be too little for them, or maybe it will be too much for them. That's then required to have a good observation and understanding of the learner. Once we were talking about it, about all the data collections that we are going to have, to understand, is it either about the numbers, frequency of it, or it would be the time duration, whatever it is, you're going to study your learner before presenting the token board. And obviously, we are going to have the choices. It could be as simple as you want this or you want that after we finish these tokens, or it could be as big as the menu. And then another thing is that it is okay if the learner choose teddy bear after he finishes his token and then changes his mind. He want to go for a walk. And that's okay. It is his choice. It is his right to change his mind. It is his time. Another thing is like giving some instructional control and controlled uh, as much as possible throughout the schedule. Yes, there are some timing of the day, some activities of the day that is impossible to be changed. But there is something, for example, during the math time, do you want to do writing the numbers first or you want to do the simple addition? Some kind of a thing that it can help him to feeling that, oh, okay, it's not only only have to follow the instruction, I can also make some choices for myself. Self-regulations and emotional regulations. Social stories is my one of my favorite uh, strategies to do that. And again, it's very important how we are making it for the learner. Again, it is important to identify and tackle the situation that we want to have it in this story, and then having a positive outcome about it, knowing our individual developmental level to how to, write down these stories. Is it a lot of wording? Is it a lot of pictures? And when you're doing this and making sure that the individual that you are going to read this for is the first character of the story, that will also increase the level of the engagement. Use a lot of clear and as much as possible, short and simple and positive languages in these stories. And then read it for the individual as much as possible regularly and encourage them into the engagement and discussion. It could be as simple as just sitting next to you and turning a page or pointing to the pictures, or it could be into a lot of conversation with you. Why did he do that? What happened next? And so on. Feelings and emotions. Again, we are going to identify the emotion that we are going to teach the child. It could be as simple as sad and happy, or it could be more complex emotions. And then we are going to, again, it can be incorporated into the social stories, or it could be throughout the cart and patterning. Try to focus on the cause and effect. What makes somebody sad or happy? And then practice it and model it together during the calm time. You can also watch some videos together. You can read the social stories together about it. Practicing it, have lots of visual support while you're talking about it. Take these visual supports as well to the other settings and try to make it as a check for the learner. How do you feel now? Or for example, when you're seeing the learner being so happy in the playground and playing, you can just present a picture of the happy that, hey, look, you're happy now. So that will be creating the better opportunity for the learner to understand it. The calming strategies. Again, even for us as adults, we don't deal even with the same situation the same way all the time. We have a toolbox with us. We are sometimes we're acting differently, calming ourselves differently with different situations. So we can also equip our learners with the same things. It can be like drinking some water, walking away from the situation, or deep breathing, or having some meditations, listening to the calming music, going to the corner, go to the sensory room. Could be multiple ways, but they have to know what are they, and they can decide how to choose how to use them and how to choose them later. The way to do that, again, we're going to identify multiple of them and we are going to practice it during the calm moment, take into the different settings, talk about it. Again, it can be into the social stories as well. And then we are going to model it and imitating each other towards it in this process, practicing it, and again, having the visual supports. So when the learner is feeling overwhelmed, can be remembering that, okay, I can use this and that strategies. This is a sample of the social story that I have made recently for a learner who was going to the nursery. As you can see from the wording, he was an absolutely understanding the whole cause and effect, the reasoning and everything, but he was just not following any class rules or any strategies or just like not wearing his uniform. So we made this story for him to be the first person and the first character of the story, and then we were talking about so many things in there that you're going to keep your uh, uniform on and all the rules inside the classroom, all the positive choices and the good choices that he can take. Obviously, in addition to that, we have had a lot of other strategies. But every time I see him, he just like opens my bag to just like read the story for me. And much, it's just like being regulated about it. He's just like giving the name about all these characters in these stories. He's just putting them as his friends around them. Okay, so just to review, let's have a look at some common mistakes to avoid. We have repeated these topics multiple times throughout the presentation. Waiting too long to look into the cues. So remember, early warning signs is just giving us a hint that we need to act about it quickly before we escalate to the escalated behavior. Taking too much control, it is okay to sometimes negotiate, give them some of the control as much as it is structured. Rush into the progress. As soon as we see the child is responding to something independently or correctly, we're being very happy and we want to go to the next step. But ensure that the child is being mastered through other people in other settings as well, being generalized before going to the next stage. Giving demand and instruction. When the child is being overwhelmed, minimize what you're talking. Do not give any instructions. Just be there. You don't have to talk. Just be there as a support. While even you're being there, your presence, your body language, and your facial expressions can calm the person down. Neglecting visual support, again, having the now and next available at all time. I was in an observation and somebody said, yeah, this student is using now and next. I was like, I can't see it. Oh yeah, it's not there now. If you're going to use something, we're going to be consistent and having a lot of visual supporting around our learners because this is something that it is reminding them and it's prompting them that I can have that. Okay, this is what I'm expecting next. This is my break card if I'm going to ask about it. These are my feelings. These are my calming strategies. Having inconsistent approaches. Multiple times it has been observed that school is doing something, parents are doing something else at home, therapy sessions are doing something different. And the only one who's going to be confused in here is the child. So make sure all the stakeholders sitting together and making sure at agreeing in one plan for the child and everyone being on the same thing. Obviously, as we do that, also the progress of the learner will be quicker. Assuming communication. Again, this has been observed many times that we have a nonverbal student, or again, having someone like the case I have been showing you that's not very functional into talking, even to pointing. And when they are moving from the classroom to go somewhere else, playground, there is no picture communication taken. There is no AAC devices taken for them. That is a way that they're communicating. So if you're not able to carry that communication with us all the way that the students is, we are going to take the risk of having the overwhelming and escalated behaviors. Because if we are going to have their communication book or their whatever they're going to communicate with us, if we're going to have it accessible with us all the time, it is also giving the chance for them to communicate. Let's just review again some of the takeovers and sorry, some takeaways. And the first thing is trust and safety. Obviously, we all know, we all been students one day, that if you are going to have a trust to the adult who's going to work with the child, it is all the interventions are going to be perfectly fine. So it's a very basic foundation of any intervention. Early recognition and identifying and reinforcing them is very important because it's going to prevent having any escalation of the behavior. Using the communication tool based on the whys and what and when that we have observed, and based on the student communication level and tools that they are doing, it is always helping us to progress with our process faster. Having the consistent support, we talked about it, all of us, everywhere. It is helping that if all the stakeholders will be on the same page, it will be making the process faster and progress for the learner faster. And as I know most of you are, patience, having the patience and empathy is the most important thing. And do not be discouraged if you see that your learner has a little bit of regression after you go forward. It's okay. You can just go a little bit back and then go forward again. All right, thank you so much, guys. And I'm going to start with the questions. Please go ahead if you have any questions in here, you can ask on the chat box. There are a lot of questions over here that is talking about the child. What do we do with the child who hits? What do we do with the child who cries? We talked about it. We are going to observe and understand what are those precursors and early warning signs. So then we are going to understand comprehensively the student before reaching to the level of hitting or crying. And I just have to respond to these questions very generally because I do not know the case exactly. Okay, I'm looking at more questions. Right. Somebody was asking that how to manage change of the event which are out of their control. Again, this is something that mainly some parents are having difficulty with. So in order to do that, we have to go step by step. We can have the small changes into their routine, small changes into this, like in a very structured way for them. We can just like change it and immediately return it back. Something that it is not going to be changed, but we are going to change it and return it back. I have had a student who was having a lot of tantrum as soon as any changes were happening to his scheduling or routine. So what we had done that we started with um, again, it's a comprehensive approach. Social stories, emotional regulations, calming strategies, all of it together, but also throughout his visual schedule, we were just starting with, hey, look, this is not available anymore. I'm sorry, it's not here, but we will have something else instead, and immediately return it back. And again, we're changing it and we're changing it, and we are going to let the student understand that it's okay if it's going to be changed. I'm still safe, I'm still regulated, and it's okay to be changed. It's a process and it's a comprehensive approach from every other strategies that we have learned together. There is a question says, there is a certain child that the moment he inserts the school, he will start saying, I want to go home, and cannot focus his studies. Even in the inclusion, he keeps on saying, I want to go home. This is a very interesting situation. The first thing is that, is the child feeling happy to go to school? Again, we're going back to our foundation, understanding that making the child feeling happy and safe and relaxed. Is this that making the child happy in that environment? What is it that is maybe at home and is not in the school? Or maybe the child is being in full of control at home and not in the school. It is important to make that environment interesting enough for the child to be able to wanting to go to the school. Right, somebody was saying a child was having a meltdown, but the trigger was not very clear. The meltdown escalated and he started hitting his head. What should we do in this scenario? You need to go and observe the precursors, the very early sign of warnings. It is most likely, it is impossible that the learner will not have any precursors, any early warning signs. It could be fidgety body. It could be just anything to their to their facial expression, to their body language. It's very less likely that behaviors are happening so sudden without any early warning signs. Go ahead, observe in details directly and understand those precursors. There was a question of strategies on how to calm down the students during the meltdown. Again, that goes into teaching them the calming strategy is number one. And we don't have to do anything at that moment. We're just going to be there and showing with our body language, with our facial expression that I'm here to help. Again, we want to avoid over talking or giving any instructions at that time. If you want to say anything, we're just going to say, you're safe. I'm here if you need any help. I understand. I'm so sorry that you're feeling upset. Because when they are in the meltdown, they are going to take their time until they are feeling self-regulated or the stress around them has been reduced.
I think, Sharareh, this would be the last question. How many minutes does the meltdown usually last? From Marvick.
Right. I think this is very difficult to say because it's not only depending on the individual, but also depends on the situation as well. It is a very difficult question to respond to. It can be from 2, 3 minutes, or it can go up all the way to 1 hour. I had learners who were sweating and tired and thirsty, but still they couldn't stop it. So it's very depend on the learner, their levels, and the situation that they are feeling overwhelmed.
Thank you, Sharareh, for this beautiful presentation once again. And thank you, everyone, for attending today.
Thank you, everyone. It was lovely to see you all. Thank you so much for participating and for the questions. I hope to see you soon.